with Miss Linda today, and Miss Linda has just completed her sessions in decompression for the lumbar spine. And Linda, I just want to congratulate you. You've done so well. And I want to go back to the end of May and tell me a little bit when you came in. What condition were you in?
I was having difficulty with mobility in walking, stooping down, well, not stooping down, but actually squatting to take care of the cat litter box. I was having problems sleeping. I only slept maybe 3 hours at a time at the max. Trouble lying on my left or my right side or on my back.
And you were not walking or vacuuming or exercising?
No, I could not do any of that.
And previous to this, you were a registered nurse.
I was a registered nurse. I'm now retired. You
retired about 3 years ago. You had pretty severe back pain as a nurse, correct?
Yes, I did. And I think it was from the pulling on the patients and the machinery. And also, over 25 years of nursing, this was a built-up.
You went through our session, and we started out 3 times a week, and then 2 times a week, and once a week, and then every other week, and you're now going to be on a maintenance, which we call the longevity program. And it might be once a month, it might be twice a month. But the neat thing is, as of today, I remember we looked in June 30th, you were walking about 25 to 30 minutes a day. And just recently, what did you do?
Last night I walked for 39 minutes on the treadmill, came home, had dinner, and walked around the block outside.
That's wonderful.
With no pain. And I slept very well last night.
And you've been sleeping since end of June, you said, throughout 8 hours per night.
Well, I might get up once to go to the bathroom. And if I do, I get up and I drink water. I'm trying to get in 7 to 9, 16 ounces a day. That's a lot of water. But I think it's really helped.
You're healthier now than you were probably 3 or 4 years ago. And that's wonderful. And you've been great just talking to the other patients here. You were skeptical. I remember the first day you came in, you weren't too sure. You almost walked out. I remember you called me and said, I don't think I want to do this. You remember?
I remember.
And
that was after you had looked at my x-rays and my MRI.
And what would you tell other patients too? You said to me, gosh, I wish I did this earlier.
I've always been skeptical of chiropractic. And my doctor had told me, it's either surgery or, he said, if you really want to go to a third thing, is where he put chiropractic, he said, then just try one. But he wouldn't recommend anyone because he said in the medical field they don't recommend chiropractic. So I found you on Yex and talked with you, and my husband and I came in and you did an interview and we did a session, and then I decided this might work because I did not want to have rods put in my back.
This was a surgical alternative, and I just say you didn't miss an appointment. You're one of our finest patients we ever had. You've been very disciplined with it, and the results speak for themselves. Today we just checked your balance and you were even, and now our goal is just to maintain this every 3 to 4 weeks, and then you'll see we'll be able to space it out so that you're coming in quarterly after the first year. Well,
I would say to those people watching this video, I've improved a good 85, maybe 90%, and give it a try. It's better than surgery.
All right. Thank you.